Hi, everybody. Welcome back to our third podcast. We are very, very honored to have Dr. Khaled Hassan with us today. I want to give you guys a little bit of introduction on who he is. He's experienced physician with over 25 years in the medical field. He's also trained at the Texas Heart Institute in Houston and specializes in regenerative medicine. And this is one of the biggest reasons why we wanted him here today. He also has trained in stem cell procedures and exosome therapy. He's also certified in Gainsway for ED treatment. He also addresses joint issues, weight loss, hormone imbalances, and facial rejuvenation with advanced techniques. Thank you so much for joining us, Dr. Hassan. How are you?
I'm fine, Dr. Asma. Thanks for the nice introduction. I'm
You're
very
most welcome.
honored.
You're one of those people that I personally love working with, especially because of your personality and then, of course, your knowledge base. It's absolutely amazing. You have 25 years of experience, and
Yes.
you also specialize in regenerative medicine, including stem cell procedures, exosome therapy. Tell us a little bit about your journey and your current establishment, Alma Med Spa and Weight Loss.
Well, my journey started as a primary care at the beginning, and I love primary care, but at the time, always my focus was to do more like preventive medicine. How we can protect before the actual things can happen. How we can
Mhm.
protect a heart attack before you have a heart attack. That was always my goal. So that ultimately leads me to the thought why we use the medicine, why we cannot use our own body to heal ourselves. Our body has tremendous capability. And in the time, I was attending different seminar on the stem cell. Stem cell was that time very early phase, around 2011, 12, it's not too much. But I ultimately come to the understanding stem cell will be the next frontier of medicine. It is still in a very childhood stage. It did not grow up yet. It has a tremendous opportunity. Our body has the capability of healing ourselves from within.
True.
Unfortunately, we do not do that because as we get older, that capability goes downhill and downhill. But providing the right ingredients, a body doesn't need body just need those ingredients, it can heal up almost anything. So that's why I'm getting more fascinated about the stem cell treatment, that we can heal up is a naturally, almost like a natural process without any medicines. Medicines, I'm not against medicine. I'm a medical doctor, obviously, but lots of medicine has a lot of side effects. Sometimes we become confused when we use is multiple medicines, that what is exactly is a symptom of the drugs, or is it side effect of the drugs, or is it a symptom of any other medical condition that confuses us. Most
True.
of us in the 40s or 50s, they are on 7 8 different medicine, and there is also drug to drug interaction, which bring a whole different, there is a whole new paradigm of drug to drug interaction. So many drugs, they interact with each other and causes a completely different things. So all of those confusing things are there. So that make me even more devoted to the stem cell or the thoughts of the regenerative medicine where your body can heal yourself. So currently, I have a weight loss center, Alma Med Spa. We do the weight loss. We do also hormone replacement. We do liposuction. We also do the stem cell treatment here, along with the various things like stem cell treatment we do for the joints, we do for the tendons, we do for some other medical situation or medical conditions. We also do for men's ED problem with the stem cell, which is called P shot. Women's problem with the O shot. We also take care of the skin for with the stem cell injection. It's called almost like vampire facelift, those kind of things. We have a varieties hair regrowth. We can have a lot of varieties of treatment we offer here at Alma Med Spa based on the regenerative medicine.
That's absolutely amazing. So, You also answered one of my questions that I wanted to ask, why you wanted to get into regenerative. I believe you're also using exosomes right now.
Yes, yes, yes,
Yeah,
yes, yes.
tell us a little bit about that.
So exosome, so if you tier up the regenerative medicine, this is a three tier. Beginning will be base tier is the PRP, which is our own bodies, one body produces platelet rich plasma. Very easy. We can collect the blood and spun in a special centrifuge, separates the cells from the fluid, and the fluid has the platelet. Platelets have about 30 plus growth factor, and that can heal up the body. The negative side is as you get older, and older means like 40 years old, which is not really old, the PRP quality gets downhill and downhill. Like anything else. I mean, we always get, downhill with the collagen, elastin, all of the things. So PRP in a young person in 20s and 30s, athlete or somebody who is very fit, PRP is the top quality. In a 40-year-old, PRP is not the best quality. On the top, if you have multiple medical problems, if you have diabetes, high blood pressure, any kind of connective tissue disease, autoimmune disease, your PRP quality is not good. So that makes us to think what else. The next tier will be stem cell, which is collected from the placenta. Now, contrary to the belief, some people believe that we collect from like abortus. We induce abortion and collect those things. That's absolutely wrong. We do not do that. We collect it from full term baby delivered by C-section. And those mothers were very young, between 18 to 24 or 23, and they were totally screened for varieties of communicable disease during the whole term of the pregnancy. After the baby was born, the placenta was donated, and the placenta was taken by this pharmaceutical company. They separate the stem cell from there, they purified it and bottled it. Now, this thing also done in a FDA certified labs, and all of those products are here in United States. So obviously there is a very strict rules and regulation. We do
Yes.
not bring the stem cell from Africa, China, or somewhere else. No,
Yeah.
produce here. Now, the third tier, which is the best tier, is the exosomes. Exosomes are acellular. These are the protein particles. They are derived from the stem cell, but they are not the cells. The advantage is they're very small, so they can go almost everywhere, and they call cell to cell connection for the better regenerative purposes. So these are the best tier. So if I go by the tier again, PRP is the bottom tier, second is the stem cell, third is the exosome. Exosome is the best.
Yes, and also, Dr. Hassan, it is true that exosome treatments are a bit more affordable than stem cells. Stem cells are pretty expensive, and then exosomes are easier also to administer.
Yes,
And
yes,
they can be used aesthetically, topically,
sure.
injectables. Hair, skin. All right. So thank you so much for that. I think a lot of people do not know that. A lot of people are scared, and I am going to jump in here and I am going to recommend this for anyone who is looking to get regenerative treatment. Please ask your physician or whoever is doing the treatment and ask them about which product they're using. Do they have the certificate for it? The third party lab report.
Yes,
And
yes,
do ask all kinds of questions that should assure you that you are getting a full on premium product
yeah,
administered to your body, skin, hair, whichever you are getting the treatment of. Uh,
good.
but it's very important that you ask your physician questions. And
Yes,
because
yes,
there's so much noise on Google and there's so
yes,
much noise out there,
yes.
you want to be absolutely sure that the products are not substandard. Thank you so much for that, Dr. San. I do wanna know, on a lighter bit, what is your favorite treatment when it comes to aesthetics right now?
If this comes with aesthetics, I love the microneedling, especially with the Morpheus microneedling with exosomes. So I'm explaining why is that.
Mm-hmm.
First of all, as you get older, obviously the skin sagging is a problem. Everywhere the skin sags because we are losing the collagen, we're losing the elastin. All of the tissues underneath gets thinner and thinner, and the skin becomes lax, which obviously do not make us as aesthetically appealing as before. So the microneedling means it forms channels through the skin with a small wound. And through the wound, also we use the exosomes, like we just apply the exosomes on the top so it can go underneath and it can boost up the collagen and elastin. My preference is the Morpheus. Morpheus is a machine which is obviously FDA cleared. It is coming from InMode company, which is a very top-notch aesthetic device producer. Again, made in USA. I do not go anything buying from Alibaba or China, something. No. This
Yeah.
is made in USA. It is approved by the FDA, certified by the FDA, I should say, in 2017. So Morpheus, the advantage of the Morpheus is these are microneedling. About 28 pins goes inside and outside of the skin. Also, it produces the radio frequency. The radio frequency, along with the exosome, along with the microneedling, is almost like you're doing microneedling with some steroids. I mean, I know
Oh,
steroids is bad, but in this case, I'm using the term because it is that much enhancing.
yeah.
It
It's an
gives you a very,
accelerator. Yeah.
yes, it's a very accelerator with all of the things. Just simple microneedling, you will get the result. But when it is microneedling with exosome, with radio frequency, you get like 10 times better result. It can be used anywhere in the face, under the arm, in the belly, in your hip, inside of the thigh, anywhere basically in the body.
Would you recommend the same treatment for stretch marks also?
Yes, that's a good question. Stretch mark, scar tissue. I mean, if somebody has a scar mark in the face or anywhere else, which especially women has scar mark, women has also a stretch mark, scar mark from the C-section or any other surgical procedure, this thing helps a lot. This thing helps significantly. 2-3 treatment is almost gone.
That's absolutely amazing. I think it's very important for people to also know why we are adding exosomes. Exosomes basically goes in, and I'm going to try this and explain this in the layman language. A little to no downtime, so less irritation,
Yes,
less
yes,
pain.
that's
It
important.
creates, goes down and absorbs in the fibroblast layer of the skin. That means that is where new skin cells,
Yes,
baby cells, are created. So
sure,
it basically, pushes and triggers new skin cell. Hence why it is absolutely amazing to use in scar removal surgeries or laser treatments or Morpheus with microneedling because it makes new cells,
sure,
new skin cells, and collagen.
sure,
So less pain, less irritation, redness, better results.
sure.
And this is why Dr. Hassan is adding exosomes into microneedling and different other things that he's offering at his establishment. Thank you so much for that. I do. What are the treatments that you actually recommend for people over 30 for healthy skin and joints? Because after 30 is when you start to see, okay, you know what? I'm not young anymore. I'm not perfect anymore. Something is changing. What do you recommend, both for aesthetic and joint? When
Okay.
do you think they should come to you and what they should start with?
I would recommend from 30 years and onwards, at least we all have a face value. So face is the first thing. So
Yeah.
face value. So for the face value, I would recommend at least once a year do some micro needling on the face. It makes so you do not have to use all of the cosmetics and everything. Cosmetics can make it just a layer on the face. It does not cause anything of the skin because it doesn't penetrate inside. Where microneedling causes it in a natural way, it boosts up your skin health, which not normally almost none of the cosmetics can go inside. So I would recommend to take care of the skin of the face mainly and any other places of the body. Number one, a lot of folks have thinning of the hair, and that is another thing. Again, keep it in mind, exosome works better when it is thinning of the hair. You just started thinning, you have viable hair follicle. Yes, it works amazingly. Now, if somebody might ask, why I'm talking about the hair when I don't have any hair. Unfortunately, that time the technology was not there.
Yeah,
I wish the
it
technology
wasn't.
was
It's
there.
true.
So, but if somebody is totally hairless, then it is out of questions. For the exosome, you probably go somewhere else for the hair graft. Even that will be very difficult too.
Yeah,
So
first you
I
have to
would
then get hair transplant and then probably do exosome for better results.
better
But
as yeah.
better start exosome when you still have the
Earlier,
hair
earlier,
follicle.
yes, yes, exactly. That's the thing you should do. I mean, earlier is the better. Is the philosophy of any treatment. Any conditions, if you wait, if it becomes a long-term chronic patient, it's very difficult to treat. And it cannot be reversible. But if you do it earlier, if you take your action early, yes, it could be reversible easily. So here is one thing. Obviously, I'll take the skincare with the microneedling. These are pretty much at the early stage, and after 30s, you should be taking care of aesthetically.
While we're at this, Dr. Hassan, what is the most common issue that your patients come with?
Well, I can divide my patient into. I mean, we are talking about now regenerative medicine. I mean,
Yes,
like in general, there is other issues, but regenerative medicine wise, younger patient comes mostly with the hair and the skincare, and little bit older, which could be some are younger patient also, but little bit older, like 50 plus patient, they come with the joints. Obviously, depends on your body weight, depends on your what kind of work you do, depends on how active you are, or whether you are a sports person. Sometimes the joint cartilage deteriorate early.
because
You
of
can because of the
overeating.
active, oh yeah,
Yeah,
yes, because of the overuse. So then obviously you're talking every joint has a cartilage in between the bone. Cartilage's purpose is it like a shock absorber? It also helps the bone to glide over each other. So you can
mhm.
have the nice smooth movement. When the cartilage is gone or almost going to finish, or actually because of the wear and tear, then you're thinking about it's very common, you're having the bone and bone grinding with each other. And that's extremely painful.
Hmm.
Contrary to the common belief that arthritis happen when you are 60 or 70, we have lots of patients in the 40s. It all depends how active you are. If you're overweight, which we are 62% of Americans, we are overweight here, overweight and obese. That's another thing. So these are the problem comes in the elderly person. Obviously, there come also the sexual issue. A lot of men come with the ED problem. A lot of women come with incontinence and also other sexual problems. So those are also problems we see.
Which you treat with exosome
Treat with
shots, right?
exams. Yes,
P shot, O
absolutely.
shot.
Patient and ocean.
A lot
Yes.
of people don't know that for ED or for sexual wellness, a lot of people go towards, different capsules, tablets, and, things like that. But guys, there is a natural way of
Yes.
getting the satisfaction, getting the help that you need. You just
Yes.
need to know about it.
Yes. Yes.
You can get yourself healed from within if you
Yes.
choose the regenerative path of medicine, right?
Absolutely. For P shot, it works. So P shot is the name of the Greek god Priapus, Priapus shot, and it was invented by Dr. Stephen Reynolds of Florida. And yes, you can give the stem cell or exosome shot in the penis, and it can regenerate inside the more blood vessels, more nerve, the sensation, and you will overcome your problem. Same way with the O shot, women come here if they cannot get the orgasm, or if they are having a problem with the leaking of the urine, which is very common in the women. With the stress incontinence, I know they cough and they leak. It's very embarrassing for them. We can also heal it with exosome shots. And what it does, it increases the elastin on the on the floor, on the tube, on the roof of the vagina, because that can controls the urethra very nicely. So you feel much better and control of your incontinence.
Absolutely amazing. A lot of people don't know about this. So thank you for covering this because it is a kind of taboo for people to, talk about, but it's 2025.
Yeah, of course.
Everything has a solution to it. All you have to
Yeah,
do is research, find the right doctor,
sure,
make sure that the products that you are getting administered are premium products and you have a solution available. Thank you
sure.
so much for covering that.
Oh, thanks.
um, I do want to ask you a related question though. When you talk about healing joints and
Yeah.
treating joints and injuries and all, how much regenerative medicines help with pain management as such? A lot of people have persistent, you know, pain, chronic pain. How does it help with that?
Yes, yes, it does. Exosome has a tremendous anti-inflammatory properties. So obviously, with any joints, there's the varieties of pain comes from the joints. Sometimes it's because of the grinding. Sometimes it's a nerve related. All kind of pains can happen. And as I mentioned, the exosomes obviously you do not get the result. You get some result right away, but the bulk result you have to wait. You understand? This is not a band-aid. We can give a steroid treatment and you can feel amazingly better but it doesn't last. It will last only for probably a few weeks. Sometimes it doesn't last only for a week, but it causes harm to the joint itself. Steroid is not good for the joint, absolutely not. It eats up the bone. Exosome, on the other side, it tries to fix the problem at the root cause. And not only that, it also anti-inflammatory. So your pain will be better, but eventually you get the result at the end of the month, third or fourth week, and then from that it will just stack up with the result for up to 9 months. You feel amazingly better. Now people question how many shots I need. It's very variable. It's very individualized. Some people need one shot and they get amazingly better for 2 years without any problem. Some people need two shot or so. So it cannot I cannot just say that you need three shot or you need one shot without assessing the person. And not only that, the person will when I to follow up with the patient, that patient will tell me whether they meet their expectation or
Hmm.
they need further.
Exactly. With regenerative treatment, guys, it's very important that you understand that there is no set parameter of how many or how much exosome you would need. It is
Right.
through each consultation that the dosage is decided, the sessions are decided. The other thing that's very important is that for myself, I used exosomes because I had 2.5 years of frozen shoulder because of diabetes, and it really helped me open up. Within 48 hours, my arm was opened up.
Sure.
So, for anyone who has issues of consistent frozen arms or neck because of diabetes or any other stressful reason like your job, Exosome is your solution. All right, let's move on. I do want to ask you, do you think that exosomes are better than minoxidil? Because that is like such a hype right now. Um,
No,
yeah.
they gotta be compared. It's like there is no comparison. Minoxidil is the medicine, is mainly the blood pressure medicine, old style medicine. It can lower your blood pressure so you feel dizzy and drowsy. It can also cause edema, swelling. We don't even use it, minoxidil, as a blood pressure medicine at all now because it can cause a lot of problems, a lot of side effects. Now, yes, one of the good side effects was it can grow the hair. Unfortunately, you have to continue using the minoxidil. You cannot stop it. When you stop it, you're losing it, everything. Contrary, as we mentioned, exosomes, what they do, they kind of make the hair follicle viable, and they act on the root cause of the hair loss, where your hair follicle is not viable and they kind of dead. They kind of makes this hair follicle grow. So obviously with exosome treatment, is then again as I say, all of the regenerative medicine, the purpose is it's not a band-aid. It's a more or less permanent fixation. So yeah, there is no comparison between minoxidil and exosome. It's not even a comparison. Not even a question.
Yeah, I do want to ask, a lot of people believe in these hair pills that they They think that, oh, take these pills for 3 months and your hair will grow back or will stay stronger. What do you think about that? Should they come for exosome treatment or should they just continue with trying different hair oils and pills?
Well, no, there is no hair oil. There is obviously minoxidil. There is minoxidil cream, minoxidil pill. But again, as I mentioned, you have to keep continue that for lifelong. The cream does not really do much, but the pill has a lot of side effect. Before you take the pill, you have to be careful. There is also Propecia. Propecia is a pill, but Propecia's problem is it significantly impairs men's ED. It can cause men's ED. The
Whoa.
and the bad part of the Propecia is the long lasting 6 months half life. So if you stop Propecia, say you started Propecia and you see some bad result in the ED problem wise, and you stop that, you do not get better not before 5 to 6 months. It's a
Wow.
long term. So be careful about the Propecia. It does work some, but again, be careful. If you want to lose that part of the body, well, then
I mean,
welcome.
what's the point then? If a medication is fixing one thing and then doing giving you a side effect that huge.
That's the exactly I was talking with you. That's my whole purpose. At the beginning, I was thinking, I'm using so many medicine and they're giving the side effect. And then I'm getting confused. Is it a new problem for the person or is it a side effect of the medicine? Not only that, then the medicine and medicine will interact, cause drug interaction, drug to drug interaction. That's a whole new subject now. We are
Yes.
now understanding it. This becomes a not a little bit. There's a book, like almost this big book with the drug to drug interaction. So it is very confusing now. So rather than when you are a better product, exosome, why don't you come with exosome and fix it rather than taking all kind of medicine with lots of side effects?
Dr. Khaled Hassan, I do want to mention this that a lot of people don't understand this because they're not from the field, right?
Sure, sure.
Us as doctors, we understand this that if you can treat something locally,
Yeah.
why would you take a medication that affects the entire
Yes,
system?
yes, yes,
Exosome can work locally for
yes,
you.
yes,
So
yes.
you either inject it or topically apply it
Yeah,
locally
sure,
to the
sure,
issue, which in this case is
sure.
scalp.
Yeah,
Um, it's better.
yeah,
Plus, exosome, wherever it goes in the body, is only going to heal or
yes,
attack inflammation.
sure,
So you might be getting it in your scalp, but your frozen arm might open up,
sure.
which is absolutely amazing. That's what happened with me from the first session. I took it for my hair, and
Yeah.
my right
Moving
frozen
on.
shoulder opened
Yeah,
up, and I went for the second one because I wanted my hair better, but I could see my arm getting
arms
better.
better. Yeah,
Yeah.
absolutely, absolutely.
So guys, it's absolutely amazing, to and it's not that you have to have a problem to try exosome. You can actually go to Dr. Hassan and get exosomes as a precautionary measure to stop yourself from aging,
Yes.
okay? Delay issues, look better, feel better, have more energy in
Yeah.
yourself. That is also where you can get exosomes for
Sure,
yourself. So
sure, sure.
thank you so much for that. I do have another question for you. You recently did a patient for hair rejuvenation through exosome.
Yes. Mhm.
You want to talk a little bit about that use
Yeah.
case?
So this is a younger gentleman, I think in the 30s. He is the professional wrestler actually. I was very fortunate. He came for me from Las Vegas, like flew here in St. Louis. So he's the right. If you see the video, you can see he has enough hair. He has started just thinning of the hair in that area of the in the like in the back of the head. So he is the right one. So we inject first. Obviously, we numb the area with a very strong numbing cream. So it is not you don't feel anything. Then we inject multiple small areas with very fine needles, very fine, very almost like a hair-like needles, and then on the top. And we inject the exosomes. And after that, I finish it doing a microneedling, so microneedling will give you a more nice and diffuse area because when we inject, I might miss one or two spot. It's possible. But
True.
when you do the microneedling in a small area, like a square, like say about 1.5 or 2 by 2 inches area, it gives a diffuse, and then we kind of Generally spray it with spray, or actually put some exosomes there and spray and kind of like, make it that evenly distributed in the area. So in that case, I know that exosomes covers almost the whole area of the bald spot. And I'm
Um,
waiting to get the result. He will come back to me in 6 to 8 weeks, and we'll see.
Wonderful. That is absolutely amazing. But I do want to mention this here, guys. You can get hair exosomes every 4 weeks if you have a wedding coming, or you're doing it because you want your hair to grow faster. You can do it, but this is a situation where he's treating a patient and he wants to give a few weeks to see the full result before he decides how many
Yes, you're right.
sessions
You're
he
right.
wants to do. So 3 weeks is where you start to see the full
Mhm.
effect of exosomes,
Right.
and waiting a little bit more also, makes sure that the patient is not paying for too much unless he really needs it. The
Right.
doctors decide not to
Right. Right.
put in because it is expensive,
Right.
both for the patient and the physician. I do want to ask you more about regenerative treatments. I know that you've covered here quite a bit. Would you pick exosomes over regular microneedling? I know that you've already covered this, but I just want you to briefly tell us why every time you do microneedling, because there's a lot of stuff that can be used for microneedling on the face
Yes.
or
Yes. Yes.
hair. Why exosome? Why would you pick that?
So microneedling is an amazing device. It comes with the regular pen, with the doctor pen, or you can go a fancy one, which I have, which is the Morpheus 8. The difference between these two is normal pen has only 14 or 15 needles, and the Morpheus has about 28. It's a bigger head. So, as I mentioned before, here the philosophy is you create the injury in the subdermis or subcu layer of the skin up to 3 or 4 millimeter. Actually, Morpheus can go up to 7 millimeter depth. So you create the injuries and the skin then heal up. When they're healing up, they create the elastin and collagen, which is the essential ingredients of the skin firmness and the thickness. Now, let's talk why we do the exosome. Now, we can do it microneedling just with the vitamin C serum or hyaluronic acid. Yes, you get the result. Again, tier. That is the best tier is microneedling with vitamin C or hyaluronic acid. Good, it will work. If you want the best result is the exosome. Again, exosome causes what it does. It causes regenerate, repair, and regrow. All of the three are. It causes all of those, and it makes the skin much better than just microneedling itself with with your like serum, vitamin C serum or hyaluronic acid. That's
Yeah.
why I always recommend that I always want the best for the patient, because that is the patient satisfaction. If patient satisfied, I'm satisfied also. So it's for my pleasure and the patient's pleasure, both pleasure. We want the best, and that is the exosomes.
And probably this is why it is also recommended in fading acne scars better to
Yes,
do
yes, yes, yes,
microneedling with
yes, yes,
exosomes.
yes. Absolutely, absolutely.
Yes, because it's creating new baby skin
Yes,
cell, guys. This is
absolutely.
why a lot of physicians who actually know what they're doing, they don't push you to go do microneedling the traditional way. They want you to go with something that would actually help heal from within and make new skin. There is nothing in this world that compares to a new skin cell. You
Yeah,
can do whatever you want with your face, but if a treatment is making new skin cell, that is better than anything
right.
in the
Right.
entire room. um, Thank you for explaining that. I know we've covered aesthetics a lot, and I know we've also covered joint healing and pain management. I do want to know, if a layman person was coming to you completely with no background in medicine, and asking a question that if I get exosome treatment in my joints or muscles, anything where pain is
Mhm.
a problem, chronic pain, can I walk pain free?
Well, again, the question will be good possibility, but it is very individualized. I can give you one example. I do some weightlifting, some workout. So for the last few months, I've been suffering from tennis elbow, which is inflammation of one of the extensor tendon in the elbow. Again, sometimes being a doctor, you're busy, you think you know everything, but sometimes you don't do it for yourself. I could
Yeah.
easily do an exosome injection here. I did not do it for a while. I was just ignoring it, and it becomes a very, very nagging pain. It's not a constant pain, but I love workout. I love to do weight, and I could not do. Right hand say I could do about 25, 30 pounds. This one only 10 to 15 pounds.
Wow.
So
That big a
after,
difference, huh?
yes, and it's been almost 3, 4 months I suffer. I always keep forgetting. And one day I said, no, it has to be end. I took like 2 cc of exosome myself. I don't like needles, but I guess I was brave enough that day. I inject here. 1 month, only in 1 month, I'm 100% pain free here, which I
Wow.
suffered for about 5 to 6 months. I mean, there is a zero pain here. I do the same weight on both hand and everything. So, in order to answer your questions, yes, but obviously we have to make sure I do not over I do not give over expectation to the patient. Every patient is different. When it comes to the pain, every single person is different. We have to understand the physiology of the patient's pathology and physiology of the patient's pain, and then we can talk. As I say, the exosome has tremendous anti-inflammatory properties. So it works immediately for anti-inflammatory properties to reduce the pain. Now, obviously, what I found in the ultrasound here, I had also did an ultrasound here to see what's the problem. I had some tendon tear, partial tear here. That was the main of the problem. So I'm sure the tear did not heal up right away. It takes time to heal up a tear. That probably, as you mentioned, probably in 3 weeks or so. But my pain was relieved because most of the time, patient comes to the doctor's office because of the pain. It's not for blood pressure. It's not for diabetes. Pain is
Yeah.
the driving factor. We do not like
Yeah.
pain. Nobody likes pain. So that's why I'm saying that if it's a joint pain or anything, come to us. We're going to do some evaluation and physical exam and find out what is the reason. And most of the time, it's possible with the exosome injection in the right place, you will be pain free, probably almost within 24 to 48 hours. But your main problem will be healed up with time. It will take time, but you'll get relief very soon, very quickly.
So it so yeah, of course, for instant pain relief, there are other ways to give you
Yes,
that
yes,
relief
yes.
when you're excruciating pain. But if it's
Sure.
a nagging pain, it's a chronic,
Yes, yes,
consistent
yes,
pain,
yes, yes,
you
yes,
can rely on exosomes.
yes, yes.
And it's very important that you mentioned that it depends. You keep saying it depends on the situation, it depends
Sure,
on the patient,
sure,
the physiology,
sure,
because
sure.
age matters also.
Of course,
Genetic issues also matter.
of course.
How bad the joint is also matters, right?
Sure, sure,
This is
sure.
why he's not giving you guys a specific timeline or number of sessions because he doesn't know what the situation or who the patient is. Um,
Right.
Thank you so much for that. I do want to ask you two more questions. I know I've taken a
Sure.
lot of your time. Why should anyone drive to Missouri for exosome treatment with you?
Very good questions. I should say I'm the best. No, I will not tell that. I will not tell that I'm the best. But I am very careful for my patient. My staffs are amazing. They're very caring staff. You feel very relaxed here because I know when you come to me, you're scared. It's a new type of treatment, absolutely new. So you'll be a little scared. Our staff will make you at home. I will explain to you everything. And the main thing is I have experience and the product I use, these are made here. Always be careful. Wherever doctor you go for any kind of regenerative medicine treatment, do your research. Where from he's getting the product. Very important. If the product is made in USA, at least there is some rules and regulations they have to follow.
Yes.
If it's brought from outside, no rules and
You don't know.
regulations. You don't know. You don't even know whether it is exosome or just water in the bottle. You never know.
Yeah. Or
So,
nutrients.
or nutrient, something. So just be careful about that. So again, as I mentioned, I'm not bragging myself. I do my best, and of course, my staffs are very caring. We use the best product. So, with all of these things, I think we can expect some very good result for the
I want
patient.
to add a little bit to that.
Okay.
You're very modest. I think one of the biggest reasons why I would drive to you, and I did tell you that I want to bring my husband to you, especially for joints, because he's had severe football injuries
Oh, wow.
in his university time, and now that he's getting old, he's on his way to 43 in
Sure.
January.
Sure.
Everything is starting to
Yes,
hurt.
absolutely. Absolutely.
Okay. Because when you're younger, you have so much energy
Uh-huh.
and
Uh-huh.
self motivation. It doesn't
Yes.
really bother you. But when you
Right,
get
right,
old,
right.
you can have pain in a 10-year-old injury again.
Yes. Yes.
Young people don't understand that.
Right, right.
So I think the reason I would bring him to you is because one of the biggest things that Dr. Khaled Hassan does is he uses the same treatment on himself. You
Yes.
use the same treatment for yourself, which you just gave an example. I don't
Sure.
know if you realize that. But, and the second thing is that you actually believe in regenerative
Sure.
medicine.
I do.
You're
I
not
do.
using it just because it's trending right now.
No. Uh-huh.
That's very important. The third thing is that a lot of people don't know this, but he not just has his own establishment, but he is also someone who goes to different other establishments
Oh,
to
yes.
treat
Yes.
different patients on call. And no establishment trusts a physician, if they don't, if they're actually trusting them to come in and treat their patient for special appointments, there's something there that makes them believe in them. So you have to also understand it's not just about the product, it's also about the physician. You can
Sure.
have three nurses doing the same injection and two of them would be very painful,
Sure.
and somebody would
Sure.
come in and draw
Sure.
10 tubes of blood and you wouldn't even feel it. So that is very important.
Right.
Experience is very important, and I think it's, and also of course it's very easy to talk to you. You're very
Sure.
easy to talk to. So
Thank
those
you.
would be my three reasons why I would drive to Missouri. Probably take a flight. It's really far from San Diego.
Thank you. I'm very honored. I'm very honored. So, yes, something like you can be very, very bookish and knowledgeable, but unless you do hundreds of joints, it's
Yeah,
all about experience. Experience does not happen in 1 or 2 days.
takes a lot
Days
of
after
time.
days, it takes time. There is no shortcut for gathering experience.
I think
So,
also, Dr. San, training consistently,
yes,
keeping your knowledge up to
up to
date.
date. Yes, yes. Yes.
Going to, a lot of people don't go to
Don't go
trainings.
anywhere.
I
Right,
think
right.
you and if you remember, I
I
mentioned
do, I do,
another
I do. I
partner
said,
we
yeah.
have. You guys consistently go every year for
We do,
trainings
we
to
do,
make
we do,
sure
we
that
do.
you're up to date and you're using the
Yes.
right medication and
and and
technique. That's
and and
amazing.
I love those training because every time I go there, I always learn something. I always there is no when somebody says I know everything, that's the end of a physician. Done.
Yeah,
You cannot say that. Every day you learn something. Every training you go, you always learn something. Always learn something.
because the disease is changing.
Yes, disease changes, the approach to the disease changes, the treatment changes. It all like evolving, all evolving things. There is nothing called stem cell, exosome, or regenerative medicine 20 years ago. Nobody even knows what is that.
Yeah,
Now it is
yeah,
evolving, but still it's in a childhood. It's
yes,
not even in your early in your like adult or what is that? Not actually adolescent yet. There's
yeah.
a child
And
still.
also, Dr. Hassan, I feel, I'm sure, we've had a conversation about this several times. There's so much noise out there because of substandard products
Yes.
that the actual miracle, drug that it is it's gone down. It's
Yes.
suppressed because of all that bad
Yes. Yes. Yes.
substandard
Yes. Yes.
product and noise
So
out
that's
there.
why, again, I will agree with you, Dr. Asma. Whatever you mentioned, before you go, I mean, you don't have to come to me. There are a lot of good doctors, of course, out there. But make sure you do your own research. What product they're using, where from they're buying, are they made in USA? Are they being checked by a third party?
Third
Make
party lab.
sure that third party lab that the standard is whatever they're saying, 50 billion, or are they free from diseases or anything? Make sure you do that. Because otherwise, just go to somebody, have exosome injections. No. has to be a good product. It all depends who's injecting and what product he's using. It all matters. Otherwise, it's not going to go. It's not going to work.
Yeah, it needs to be establishment that works on a care model,
Right.
fully trained, trusted. I think one of the other things that's absolutely amazing about your establishment is Jessica.
Yes.
She is so comfortable with regenerative treatments, and she just
Yes.
comes off with such confidence about it.
Yes.
Oh
Yes. Yes.
yes, yes, I do this, I do that.
Yes.
I think
Yes.
it's
Yes.
that's also very
Yes,
rare.
yes. As I mentioned, our staffs are amazing from the front desk, and Jessica is an RN. She is a very good addition to our establishment. She does amazing microneedling, unbelievable microneedling. I mean, I am due for one. I probably will do like very soon.
Ooh, nice inside story.
Yeah, I mean, she does amazing. Her jobs, especially the microneedling jobs, are like mind blowing job. I also do microneedling, but I can easily say she does much better microneedling than me.
I think it's the attention to detail thing with her.
Yes, she is very, very focused to details, and she does amazing job on microneedling hair. Those things she does mostly. I do mostly joints and other stuff. So, but again, as I say, she's knowledgeable, she's efficient, she is a registered nurse, so all of the knowledge is there. Everything is there.
Last question,
Sure.
Prasad. Do you have any promotions or discounts for our viewers so they can come to you for
Yes, yes,
anything?
yes, yes. We can give at this moment anything like 10% discount on all of our services, all of the exosome services, whatever we offer. In our website, you can see as a big list of our services. All you have to see that whether the services you like, if there, and you can call us. You can call us. That's a free consultation. We can talk about the price and everything, and then you just have to come here.
Guys, i
And
would i would really want you to take advantage of this. Go through this session. We will provide you with the contact details of his establishment, and his booking link, so that you guys can go in and see what you need. You can always call in and have a conversation with them before you go for consultation. Thank you so much, Dr. Hassan, for your time. I know you're really busy, it's really hard to catch you, but thank you so much for giving us this honor to have a conversation with you.
thank you, Dr. Asma, and thank you all the audience for your time. And make sure drink lots of water. This is very important. We have to drink at
Yes.
least 2 to 2.5 liter water a day. Okay,
Wow, that's a
please
lot.
do that. Yeah, well, you have to do that. All right. See you
Thank you
next
so
time.
much.
Rejuvion Health, healing the future.